Understanding antibiotics are powerful allies against bacteria. Antibiotics are like magic bullets, specifically designed to target and eliminate bacteria. These microscopic organisms are all around us, and while many are beneficial, some can cause infections. Antibiotics work by disrupting the bacteria's essential functions, such as building cell walls or replicating their DNA. Penicillin, discovered in 1928, marked a revolutionary moment in medicine, ushering in an era where bacterial infections became treatable, saving countless lives. Before antibiotics, even minor infections could be lethal. Pneumonia, sepsis, and wound infections were often death sentences. Antibiotics revolutionized healthcare. They provided a cure for previously deadly diseases and made complex surgeries possible. Antibiotics are crucial for treating bacterial infections. They are a cornerstone of modern medicine and public health. However, their misuse has led to a growing problem: antibiotic resistance. Antibiotic resistance is a serious threat to global health. It occurs when bacteria evolve to survive exposure to antibiotics that would typically kill them. This happens for several reasons, but a major factor is the misuse and overuse of these crucial drugs.
One common way people misuse antibiotics is by taking them for viral infections like colds and flu. Antibiotics are ineffective against viruses, and this inappropriate use only fuels resistance.
Another issue is not completing the full course of antibiotics as prescribed, even if you start feeling better. Stopping treatment early allows the surviving bacteria, which may have developed some resistance, to multiply. This can lead to a resurgence of the infection, potentially making it harder to treat the second time around.
Taking antibiotics without a prescription is also dangerous.
Antibiotic resistance is a global health crisis. The World Health Organization has identified it as one of the biggest threats to global health, food security, and development today. The more we use antibiotics, the less effective they become. This resistance means that infections that were once easily treatable with antibiotics are becoming harder and sometimes impossible to cure. The consequences can be severe, leading to longer hospital stays, higher medical costs, and increased mortality rates. Section 4 superbugs are harbinger of a post-antibiotic era. As antibiotic resistance grows, we face the alarming prospect of a post-antibiotic era. This is a future where common infections could once again become deadly. Already we are seeing the emergence of superbugs, bacteria resistant to multiple types of antibiotics. MRSA, methicillin-resistant Staphylococcus aureus, is one such example. These superbugs pose a significant threat, particularly to vulnerable populations like newborns, the elderly, and those with weakened immune systems. Section 5. Using antibiotics responsibly, a shared responsibility. Combating antibiotic resistance requires a multifaceted approach. It involves a shared responsibility between healthcare providers, patients, and policymakers.
Doctors and nurses play a crucial role in prescribing antibiotics judiciously. They must ensure that antibiotics are prescribed only when absolutely necessary for bacterial infections and not for viral illnesses.
Patients, on the other hand, must follow their doctor's instructions carefully, completing the full course of antibiotics even if they start feeling better sooner.
Section 6. Staying healthy in an era of resistance, proactive steps for a healthier future. Beyond responsible antibiotic use, there are several things you can do to protect yourself and your community from infections. Regular hand washing is one of the most effective ways to prevent the spread of germs. Vaccination is another crucial step in preventing infections, both for yourself and for those around you. By getting vaccinated, you are not only protecting yourself, but also contributing to herd immunity, which helps to protect those who cannot be vaccinated. Maintaining a healthy lifestyle can also strengthen your immune system. Eating a balanced diet, getting regular exercise, and getting enough sleep are all important for a robust immune response.